In northern Cambodia, we're with doctors on an urgent mission. Malaria is common here. But some of the drugs used to treat it have started to fail. Now the team is trying to find an alternative before it's too late.
How dangerous is it if malaria is becoming resistant to the drugs?
Yes, it's really a big problem if we don't have effective anti-malaria drug. Most of people will die because we don't have any drug to treat. Yeah.
We've been called to a suspected case of malaria in a remote village. A young woman bitten by mosquitoes, now suffering from fever and pain. A local health worker is ready with a test kit when we arrive. A drop of 32-year-old Huang's blood is taken. And then we wait.
So what does that mean? One line.
One line that means people have no malaria.
No malaria.
Huang's test is negative. Thousands of others aren't as fortunate. Malaria has been on the rise here. In 2016, there were 20,000 reported cases. In 2017, that had risen to 50,000. And the problem is that drugs resistance is also going up. And that's not just dangerous for people living here, but potentially for people around the world if it spreads, putting millions of lives at risk.
So I was going to put this in your ear.
At the clinic, 12-year-old Duong is on an Oxford University-backed trial combining 3 antimalarials. Resistance to 2 of the most effective drugs has spread from Cambodia to parts of Thailand, Laos and Vietnam. Doctors hope adding a 3rd medicine will stop it in its tracks before it reaches Africa.
Previously, when we had the resistance to chloroquine back in Africa, we saw a massive upsurge in deaths and morbidity from malaria. And it was only because of the ACTs that came along that we were able to kind of bring that down and start getting it more under control. But if we get failures from that, then we'll kind of go back to the dark days of seeing all these deaths among children and getting to the case where we might get malaria that isn't treatable.
22-year-old Bon Lai has finally recovered from the disease thanks to the new treatment. He says in the past, the antimalarials he was given didn't work. Bun Lai is right to be worried. More than 200 million people get malaria each year, so an untreatable strain would be catastrophic. But if these scientists can beat the parasites in Southeast Asia, lives around the world could be saved. Siobhan Robbins, Sky News, Cambodia.